Hello everyone, I'm Anna and I'm a medical doctor and a plastic surgery and aesthetic medicine enthusiast. Today I want to talk about what you should keep in mind when choosing your plastic surgeon. I will give specific advice on nose job, otherwise known as rhinoplasty, but the advice I'm giving applies to general plastic surgery also. If you are interested about plastic surgery and aesthetic medicine, like and subscribe. Let's skip through the phase where you just watch Facebook pages or Instagram pages of surgeons. I think that's the easy part. Let's get on with the difficult part. There are two steps to consider: the online search and the face-to-face consultation with your surgeon. That after you have chosen a dozen of surgeons that you think might do good work for your case, you have to check if they are board certified. In the US, I live in Italy, we don't have board certifications here, but we check with the specialty residence that the doctors have done. So we also check qualifications. When checking the qualifications, it is important to see the year of this qualification, because choosing a surgeon who is like 50 years old does not make them a surgeon that has many years of experience just because he's more aged than a 40 or a 30-year-old. I have seen curriculums of 50 or 60-year-old surgeons that have been doing like general surgery and have decided, like after 10 years well into general surgery, to do plastic surgery. And there are people that have only like 2, 3, or 5 years of experience, but give off the image of having so much more experience than they really have. So when checking the board certification and the CVs, you have to check the year they got their qualifications tested to be registered on the board. To check these board certifications, you have to go to an official site of the board certification site. Do not check only the doctor's official site. Of course, the doctors, if they have something to hide, they won't be giving off that information on their site. After you have checked and lowered your number on surgeons to choose from at 2, 3, 4 surgeons, then you have to do face-to-face consultation with them. See if you can really communicate with them, if you feel comfortable having the operation done by them, and especially bring out all your concerns about the aesthetic aspect and the function aspect. Now, specifically for rhinoplasty, you have to address if you have any functional problems like bad breathing, or if you just want the aesthetic intervention done and not the septum and the internal structures modified. When talking about rhinoplasty, I would suggest to choose an ear, throat and neck surgeon and not a plastic surgeon. Admittedly, rhinoplasty is the hardest and the most difficult plastic surgery there is among plastic surgeons. The ENT surgeons are specialized on working on noses, so I would recommend to choose an ENT surgeon that is specialized on aesthetic rhinoplasty too, not only on the functional problems. Clearly, if you want an aesthetic intervention done and do not have breathing issues, you could consider plastic surgeons too, but I think it's safer to go with an ENT. After you've discussed of aesthetics and function problems with your doctor, the face-to-face consultation is the right time and place to have some difficult questions. You should ask, how many operations does this doctor do each day? And then asks how much the doctor thinks that will be needed for your operation. And if a doctor tells you surgery will take something like 1 hour and a half or 2 hours, and then he responds that he does 3 or 4 surgeries every day, so if something goes wrong in one intervention and the closing of the sutures and the patients gets delayed, then what will happen is that all the other interventions after that will have less time of work time. People don't know that in the operating room, the surgeon has many people pressing on him to do things according to the timetable. So the anesthesiologist will be buggering him to finish early if he's getting late, and the nurses too. This is why, in my case, I chose a surgeon who did maximum 2 operations a day. When paying like thousands of dollars, thousands of euros to a surgeon, the minimum a patient can ask is like 100 dedication and time flexibility with his operation. If something goes wrong, the doctor should have the time to work properly and resolve the problem and close the patient with the maximum aesthetic result as the patient has asked. The second uncomfortable question that you have to do with the surgeon during consultation is what could go wrong. A good surgeon will be transparent and will list at you all the risks and all the complications that might occur. By giving you the full information on the risks, you will be able then to ask him, if something goes wrong, how will you take care of me, and what extra money should I spend on a second intervention? There are doctors that take like full responsibility and do the second operations free of charge, but there are doctors that tell you, no, I will do the operation free of charge, but you will have to pay like the clinic and the operating room expenses, which are thousands of euros or dollars again. Money should not be a factor on choosing the best doctor, but having trust that the doctor will take care of any issues if they occur free of charge is actually something that might save you thousands of dollars long term. So I would prefer paying like 1,000 or 2,000 more, given the fact that I have the guarantee that if something occurs, this doctor will take care of all the other expenses, which is something that cheap doctors do not do. And not all of them. There are also like very, very costly doctors that do not talk about this. And after the deed has happened, after the damage is done, they come forward to you telling, okay, I will operate you, but you have to cover the clinic and the operating room expenses, which are very, very costly. These questions should be done on all plastic surgery interventions. A bonus tip I want to add specifically about rhinoplasty, there is a telltale sign which separates like the very good surgeons from the mediocre surgeons of nose surgery. All mediocre surgeons can do open rhinoplasty. Open rhinoplasty is where they cut off your columella and strip off the skin of your nose, and they actually operate on you with the structures of the nose nude, like without the skin and the fascia. And it is an easier operation for them to do, but it is a much more damaging operation for the nose. The best of the best doctors are very comfortable operating in blind, only by doing a very small section. This is called closed rhinoplasty, where they insert all their scalpels and instruments from very small forums anyway, and they operate on blind. This is called closed rhinoplasty, and this is something that only a very, very good and experienced doctors can do. So for today, that's all. And if you liked this video, please hit the like button. And if you are interested in more content about plastic surgery and aesthetic medicine, then hit the subscribe button. Thank you so much for watching this video. Have a nice day.